Hey everyone, and welcome to week 4 and 5 of my Achilles rupture journey and recovering, healing, rehab. So I am covering week 4 and 5 today. So the first thing I wanted to talk about was using my crutches still. So I have been reading up a lot of things, and everyone's injury is different. So if you read things, some people start rehab quite early, others get off crutches really early as well. Some are still on crutches from 8 weeks. So it varies on your injury and your personal circumstances. So for me, in week 4, I still use crutches, but only when I'm doing long distances. So if I go and watch my son play football, I have to use my crutches to get to the other side of the field because it does hurt trying to walk that far. But if I'm at home, I can walk up and down the stairs, go to the kitchen, go outside, go to the bathroom, whatever, and I work from home. So, just that is fine. I don't need the crutches for that. And I've been weight bearing basically since I've been in the boot. So I do use them still, which is still helpful. The other thing is cleaning the boot. So if you do have one of the boots that I have, which is an air cast, you might wonder how to clean them. They do say you can hand wash them in a cool wash, and then you have to let them air dry, and don't put them next to any heat sources and things like that. So don't put them in the tumble dryer. So in my previous video in week 3, you'll see the boot dismantled. I take everything out of it and that. And I'll put a picture up in this one to show you what I put in my boot as the sort of sock or inner insert that goes around your leg to soften and make a cushioning from the actual plastic of the boot, because while I was waiting for it to dry for the day, I couldn't exactly sit without it, and I didn't want to risk a re-rupture, going to the bathroom and maybe slipping on the way or bumping something. So I used some towels, and it was quite a colorful look, as you can see in the image I'm putting up. And I used another towel and rolled it up to give it that sort of wedge, to give you that angle down so your foot is still facing down. Cleaning the boot. We did a light wash, cleaned it out, put it outside in the sun to dry. And it was dry in a few hours because it was a sunny day, and it actually worked out quite well. The one thing you will notice when wearing the boot, because you have to wear it all the time, even when you sleep, is you will obviously sweat in it, and it will smell, so washing it helps. And the other thing I got was some foot sprays, which do help. So I spray the boots every night I spray it, so it sits for a bit while I'm doing my exercises. And it does help with the smell. Everyone says they don't smell anything, but with me, I can, I do smell it, and it bothers me, so I'd rather not do that. And also in week 4, I have removed a wedge. So one of those wedges that I've got, let me just get it quick, just to show you. So here's the wedge that I have. You get different wedges, but the thickness is roughly the same on most of them. This one is a rubbery consistency, as you can see in the light. It's quite bendy, so it does compress when you put weight on it. I'll try and show you there. Other ones I've seen are similar like this, but they're like a foam. So it does the same job. I've got another one here to show you how that works. It sort of puts like a high heel on your foot, so you can see there. And it will give you that slant so your foot faces down. You don't want to be too much level at this stage, well, particularly with my one. So those are the wedges. I'm down 1, so I've got 2 left. And the other thing that happened was they booked me in for an ultrasound. So I went to have that done, and the lady was there. She said she already did. I asked her, how often do you do Achilles and that, because she does scans for everything. And she said she did another 3 that day. So it seems to be quite a common thing. And I asked her, I know you're not a doctor or anything, but from your experience, what does it look like? And she said it's sort of medium-ish. She didn't quite go into more detail. She did explain to me how the tendon would knit together if it was a close joint and things like that, and the different types of tears, which I thought was quite interesting. She says there's 3 different types of tears. You get sort of a partial tear, And she says that the tendon is sort of like, it's got lots of fibers. And the thing that I sort of relate to or see is the movie Avatar, where they have that hair thing and they put it into the animal thing and it sort of joins up with the plants and all that kind of stuff. That's sort of how I see it. And she says it's sort of like that, but it's like a rope with intertwined nylon and things like that, and it's twisted in. So when a rope is stretched, that obviously puts pressure on those little strands. And one of the tears that you get, she says, is an internal tear. So the actual tendon looks fine, but right in the middle are some tears that happen, and it creates sort of a bulge. So that's one of the tears you get. The other tear is a partial rupture, which the outside would come out, and the sheath that holds the tendon would split open, and some of these fibers would pop out, and sort of it looks like a rope or a cable that's being stretched, and you can start seeing pieces twining off. That's the one tear. And then she says then there's a full tear, which I have, where basically the tendon just snaps totally and pulls apart, and then those fibers actually retract and curl away, so it makes the gap even bigger. They don't sit and actually try and rejoin. So that's why they put your foot in that plantar flexion thing, so you're not square on like that with your shin here. You'd like that, so the tendon here, which would be your Achilles by your heel, gets compressed together. So hopefully that closes the gap, so these tendons can try and get there to try and heal up. But anyway, so I had that done, and and then following on to that, going into week 5, the doctor booked in a review for me. So I went in and they discussed the scan with me, and it wasn't great news. They said the gap is still 22 millimeters, and they said that surgery is usually done when the gap is 10 millimeters, so 1 centimeter. Now mine was 22 after virtually 6 weeks of healing, which isn't good. Well, 4 weeks when the scan was done, and then week 5 to 6 was when I saw the doctor. So they said I should have had surgery. So they said it is late now. It does cause complications trying to do the surgery now because of all the scar tissue, they said. Nerves are starting to be laid down in the scar tissue and things like that. The gaps filling up with scar tissue. So it wasn't great news. They said that the tendon's going to heal long, which means when I try and do a calf raise and go on my tippy toes, it might not flex as easily as my other calf anymore. So I will lose strength there. So they said that healing long isn't great. Healing short is better because you can always stretch a tendon over time. And if it heals too long, then you're going to have surgery to shorten it. And, that's not good either. But anyway, they said I should have had surgery. But they are suggesting and recommending not to do it now because it's too far into the injury. And it can cause other things with my calf and nerves and all that kind of stuff. So I'm not keen on that. So I'll carry on with their treatment with the conservative care and no surgery and see how I go. I'm determined to do my exercises when I see the physio. I am going to make this work. I'm being positive because I'm seeing a lot of people on a group that I've joined that are struggling with the same thing, even worse, and they are getting some good results. So I've had loads of injuries in my time and I've come out strong, so I don't see why I'm not going to do well in this one. So I'm going to keep going. I will keep doing my videos. I hope you guys keep coming back to see my progress. And for anyone who has experienced a rupture like this, which I hope you don't, it's not nice, but I hope these videos help you guys understand what it's about, what to expect, how you should be feeling if you're feeling down. You go through all these different stages of emotions and things like that. You think a lot of things of what's going to happen, what ifs, and I think a lot, which isn't good. And I really look at the worst scenarios ever, and anything better to me is a bonus. So that's the result, which isn't great. I'm still weight bearing. I can walk on it fine. Even when I take the boot off, I can walk on it a bit. But obviously sideways, like my zombie walk I showed you in week 3. I have experienced a bit more burning pain. Even when I'm not walking that much during the day, there's a bit of burning just above my heel. And then there's a little burning as well further up by the calf. But other than that, I'm carrying on. I'm going to carry on with my document they gave me to follow what happens with the weeks and the wedges and things like that. I'm going to stay positive. I've got to make this work because it's not great. You can't walk around with a boot forever. So that's my update, week 4 and 5. I hope you guys find it helpful. I will do week 6 and probably 7 together as well, where I'll discuss the group that I've joined, where loads of people are experiencing similar things. So you can see there's more support out there for you guys. And I'll see you guys for that. Cheers.